Hi guys. How is everybody? Okay, so this is the last panel before you get to go to your happy hour. And we're going to talk about workplace benefits. And it's the last panel of the day. So we have a challenge. And I think the first thing we should do is everyone needs to stand up. Just, we gotta get this excited. We've got to be interested. You're going to get beer after this.
Stretch it out.
Yay! Okay, good. So I also want to get a sense of who's in the audience. Who are you? Are you business owners? Are you therapists? Let's start with therapists. Oh, wow.
All right.
Okay, good. So that's a lot of therapists. I'm like really nervous about anything that I'm gonna say. What about business owners? Okay, a few, that's good. A few, okay. It's hard to see. Who else might we have? Therapists, business owners, who else are you? Anyone else who isn't in one of those categories? Press, okay, good, me too. All right.
Woo!
All right, well, cool, so that's just good. So we're gonna have Q&A at the end, but I also, the idea is this should be engaging and think about your questions and don't just dream of your beer, although that will come soon. Okay, good. So we're gonna have everyone just briefly tell you their name and what they do or what company they run. Okay?
Hi, my name is Andy Sekel, trained as a clinical psychologist, practiced for a long time, and just finished 10 years at Optum Health, and now I'm an advisor to Talkspace.
Yay, Andy. Okay.
My name is Terrence Cummings, and I run business development for Stride Health. And so we help individuals to navigate the world of health insurance. That's finding, buying, and managing their health plan throughout the year.
Yay, Terrence. Okay.
Hi. Yep, I'm Cheryl Swirnow. I'm the co-founder and CEO of Sherpaa. And our job is to make healthcare accessible and affordable for businesses and their employees. And so we provide them with healthcare via the internet.
My name is Jordan Goldberg. I'm the co-founder and CEO of stickK. We help users set and achieve their own personal goals and establish some great behavior change. In addition, we run corporate-based incentive wellness programs.
Okay. Good. Everyone's still there. Okay. So first of all, want to start with some broad questions. Everyone can sort of participate, jump in. How are employers' perspectives on mental health care changing in the last few years? And maybe we could do a little prediction in the future too.
I think they're changing a lot. I think some of the changes happened because of ACA and because of the parity laws that
ACA?
Affordable Care Act, better known as Obamacare. Okay. And because many of you know, right before ACA passed, Patrick Kennedy sponsored a bill that provided parity for mental health, which meant you couldn't restrict mental health benefits in any different way than the rest of healthcare. So I think that changed employers' view. It opened up mental health in a much bigger way. And I think many of them have recognized the contribution that mental health issues have toward chronic illnesses and the overall wellness of their population. And most importantly, for a lot of employers, they've recognized that engagement is a really important part of the workforce and that mental health problems deteriorate engagement.
Okay. Anyone else want to participate in this, how employers' perspectives about employee mental health?
I can pop in. So we deal primarily, let's say, only with the individual coverage market. So just to put that as context, and one thing that's really interesting, I think this is building off of what you just said, is I think there is a perspective now with who we work with where there might not have been before. And a lot of that is because through our platform, what we actually bring up are people that tell us that they actually have issues with depression. And these are issues that prior to that, it wasn't even known. So we can bring data that says X% of your population actually says that they have issues with depression, and that surprises, a lot of people. And so for us, I'd say that there has been like a more important emphasis, I think, placed upon it, just generally, where there might not have even been before because the problem wasn't known. It just wasn't surfaced.
So more of an understanding is meaning that employers are paying attention more.
Yeah, exactly.
Yeah, we're seeing the exact same thing at Sherpaa. One of the buckets that we offer, so when an employee first logs into our site, they tell us they're sick, they're hurt, they need a prescription refill, et cetera, and one of them is I have a mental health concern, and that is our fastest growing bucket right now. And it's everything from general workplace stress up until the more chronic issues. And so we're seeing employers getting that information, understanding that their population, while they might be young and healthy, mental health is a huge portion of what that is, and they help to try to destigmatize that and provide access so that people can get the care that they need.
Yeah, I think we've seen at stickK, from a corporate wellness perspective and from a benefits perspective, is employers used to come to us, say 3, 4, 5 years ago, and they would say, you know what, we just want to get our employees to complete their health risk assessment and complete their biometric screening, and that's it. Maybe focus on some physical activity and some nutrition-based goals, and we would set the frameworks for that. But what we've seen now is employers saying, well, we really care much more about total lifestyle behaviors, right? So it's not just physical activity and nutrition. It is mental well-being. It is different forms of stress management. So now we're actually creating goals for the employees of our large clients around what we call financial wellness, because obviously that's a big contributor to stress. We have goals around work-life balance and getting good sleep habits in place and making sure that people have digital detox times. And I think it's really important that employers have begun to realize just how critical of a role these little behaviors play in people's mental well-being, and I think that's why you're starting to see a shift in their perspective on the issue.
And do you think they're caring more because it's the right thing to do, or because it's making their employees more productive if they're taking more interest in this, or is it some of both?
I think it's some of both. I mean, I think there are a lot of employers who are in it because they want to have employers who are happier and more productive, and that's going to contribute to their bottom line. It's also a retention tool. At the end of the day, these benefits become important because if they're not offering them and competitors are, they might lose out on some key talent. So, but yes, I hope at the end of the day there's some intrinsic motivation about the fact that it's the right thing to do. I think you'll probably see a mix of incentives when it comes to that.
Yeah. Okay, good. So talk to me a little bit about sort of the difference between millennials and how millennials and maybe how older generations are willing to engage in mental health care benefits offered by their employers.
You want to talk about millennials? You mentioned.
No, I actually don't want to talk about millennials. But I would talk about boomers, which I belong to. So, we had this discussion earlier, and I'm not sure there's a huge difference. I think there's been this notion that people of my generation don't want to use technology, and I think that's wrong. I think we're all very engaged in technology. When we look at some of the data, even at Talkspace or other sites, then you realize that people that are in Medicare now are using technology a lot, and a lot of the large Medicare providers are promoting the use of technology. So I think 10 years ago, that might have been true that boomers were still getting used to technology. I have an 85-year-old grandmother, and we saw her recently, and she said, the best thing that ever happened to me was texting.
Wow. And okay, so also how about the, not just the technology, but also the idea of engaging with mental health benefits? Do you think that younger people are more willing to? Is there sort of more of a stigma for maybe older people?
I don't know if they're more willing to, but I can say that they are very much so willing to.
Okay.
And it deals with part of it's, I think, technology, but the other part of it, I think, today is just the idea of privacy has changed, right, and kind of gone away. The word stigma has come up a lot. I think the stigma and the cloud that lives around it has started to dissipate a little bit. And so people are more aware and they have more data that there are issues out there, and so therefore you're not alone. And it's not as big of a deal, I think, to seek these benefits. I will say that it's still incredibly difficult for both groups to be able to find the benefits they need, whether that's in finding a therapist or the right therapist or a counselor. I think that's still very difficult, even though things like the Affordable Care Act have tried to make it simpler, right? They've mandated that plans that's equal, right? There's parity, but I think when it really comes down to it, it's still difficult for people to actually get the help they need, but they're very willing to.
Yeah, and I think that partly happens, I mean, we were talking earlier, because access is defined as having someone within 8 or 10 miles of where you live.
Yep.
And people that work on campuses, jobs on campuses, or don't feel like traveling 8, 10 miles in Southern California. So I think what ties the generations together is that we're all interested in getting easier access.
Yep.
It's also the right access,
Yeah.
too, which I think is a huge piece of what we do. For us, on the mental health side, it's about finding the right professional. You might come to us with an eating disorder. You're going to seek different treatment and need a different provider than somebody that's coming to us with a relationship issue or a deep depression. And so I think it's important not only that it's somebody within 8 or 10 miles, but it's the right person within 8 or 10 miles. And I agree, people want that ability to be able to seek that help, I think, more than ever. But it's finding the right help and knowing how to get that.
Yeah, I would agree. I think, to both Cheryl and Terrence's point, access, it's not that the fact that the access isn't there, it's about the communication that's often the bottleneck. I find that I often have conversations with folks. They ask me what stickK does, and I explain it to them, and they say, oh, my company could really use something like that. And then I go and do my homework, and it turns out they are, and the employee has no idea. And it's not because the vendor that they're using is not a sufficient product and ours is so much better. It's that the communication piece is often really lacking, and people don't even know what's offered to them by their employer. So I think the communication is a big bottleneck. But I also want to go back to a point that Andy touched upon at the beginning of this question around engagement, especially when it comes to the technology. And so this stereotype that the older generation isn't really as adept. We have found that we engage people over the age of 45 almost equally as the people under 45 for our corporate offering. There's a slight skew to the younger population, but the average age of an employee who's eligible to participate in our program is 44. The average age of an actual employee is 40. So we do a pretty good job from that distribution. And I shouldn't even say we do a good job. It's not any brilliance on our part. I think it's the fact that, it's great to see the fact that the older population and the younger population can both equally engage with technology. 5 years ago, maybe that wasn't the case, but today I think they've caught up.
And do you think that have you heard any hesitation from users on talking about, as you were saying, so one of the most popular questions is people log in and they say, I have, a mental health issue. Is there any resistance or hesitation or inhibition towards, saying that they putting into the etherwebs, the computer, making it, in the internet that you have mental health issues?
We haven't seen that, but I think it's also about building the relationship and about the communication, as you said. So for us, it's knowing that there's somebody on the other end. It's not just going out into the ether that somebody's going to be able to help you, but we really haven't seen that. And I forget who brought it. I think you brought that up as well. Other areas that we're finding kind of tie into mental health our finance questions. We have sex questions in our wellness side that are very often much more about mental health than they are about actual sexual health. And so I think that people aren't really having those issues. And again, the word stigma has come up a lot, but I think people want to get the access, they want to get the help.
Yeah, and I think it's really upon us about the security of our systems, because Absolutely. It shouldn't go out into the ether now.
But of course it shouldn't, but I think there's just the fear maybe.
I think there's that fear, but part of developing that trust relationship Absolutely. Is really reassuring people that you have a secure site and that you've done all the HIPAA requirements and all the things that make it secure. And I think sometimes people don't understand that, but it's a part of, I think, the education that you're not, buying something on eBay you're really on a different kind of site that has a certain level of security that makes it really hard to access your person. And that's an issue for all of us.
Yeah.
I mean, we're all required by law to have secure information. We all have standards that we have to adhere to. And we just have to keep educating people that those standards and those systems are in place.
Yeah, I think that's exactly right. I think the security is there, but then it's to your point, it's the trust. It's again, going back to the communication piece of it, right? Which is that, we have employees that will write into us, into our customer support. They'll say, does my employer have access to this? And they don't, but you have to be, it's not just about convincing them of that fact, it's about setting the entire stage. So we white label our products, and they're branded for our clients, but we tell them, it's not that we want to promote our own logo for stickK, but we want to make it clear that there is a third party that's managing this, and that as a result of having that third party who's responsible, it helps divorce a little bit the association between my personal health and my employer. We're sort of that buffer. And I think that's an important piece that all of us have to play when we're dealing as an intermediary between the employee and the employer.
Are you guys still with me? Yes? Okay, good. We're going to go to questions in about 8-10 minutes. So if you have questions, start thinking. Okay. So how about, sort of the future trends of health benefits? Now that there is so much more data and there is so much more information, talk about personalization of benefits. How are benefits changing, and how will they become more personalized?
So for us, as I said, we're focused on the individual market, and personalization is incredibly important. It's the core of our system. And so as someone comes through our system, they provide us with all the standard information like age, gender, et cetera. And they also tell us what their current conditions are. They tell us what prescription drugs they're on. And we use that to recommend the right healthcare plan, right? And additional benefits for them. And so, for us, it's incredibly central. It's not I think the days of the aggregators, I think, are kind of over, where you can say, here's the full menu and choose what you want. And it's a time where people are more willing to provide data. And so if they're more willing to provide data, we can use that data for their benefit. And so as a part of that, I'll kind of go back to the last question too. I think it feeds into trust as well. Because as long as you show them value, and particularly it's real-time feedback and value all along the way. Right? People aren't willing to just provide a lot of data and then you say in 3 months you're going to see why you provided us that data. So each step, looking at our experience, each step as you provide us with more data, we then provide you with, it might be as simple as here's how many doctors in your area, or here's the average cost of a plan based on your zip code, that kind of thing. But we just provide them with more and more information. I think that then fuels trust. You say, okay, you asked me that because you're going to give me something. Mm-hmm. You also establish credibility. And that's incredibly important. So that tying into the personalization, those two really go hand in hand.
Mm-hmm. So it sounds like what you're saying is kind of baby steps. You give me this information, I'll give you this. You give me this information.
But that's what we found works incredibly well with sensitive data. Right? Otherwise, you're asking for a lot of sensitive data, and you're up front, and you're not showing
person
anything.
I've never met. Here's all of my information.
Exactly.
Yeah, I think personalization, besides how it impacts benefits, will also go deeper into as electronic medical records become more pervasive, where I think we'll have better recommendations for individuals about here are some things that you could do that would mitigate some of the potential problems that you're having. So, a simple example is, if you have even a mild heart condition, you're probably more prone to depression. And those kinds of pieces of information that can really help someone in some pretty significant ways, I think will become more of the dialogue. So we're all making sure that people get the right kind of benefits, but then the next step is making sure they get the right kind of care.
And we're actually doing that now.
Great.
So when an employee first logs in with Sherpaa, they do a risk assessment in HRA, and when there are things like they're tracking for heart disease or anything, that will automatically create a case with our mental health professionals, with our doctors, that will then say, okay, you have a risk, we're flagging it, and let's start to work together on a plan. And I think that that's the real key here from a healthcare perspective. People want a plan. They want to be engaged. They want to feel like they're a participant. They're not just being told what to do, that there's some level of engagement. this is the plan, do you agree to this plan? And that's how you really get people to stick to a plan, and that's how change actually happens. I think when you tell everybody, this month we're losing weight, as a corporate challenge, that's ridiculous. Nobody's going to do that. So I think it's, what are your challenges, what are you looking to do, and then let's work together with a professional to come up with a plan that we can all adhere to.
Sorry, but I think it's a huge, what you both said is incredibly important, because we are at the stage where I think a lot of places, they'll sell you benefits, and then that's kind of the end of the relationship. And the benefit is only as good as how much you use it. You're not going to value it if you don't. And so getting the support of, as we talked about earlier, actually finding the right person to go talk to, that's a huge component. And so actually personalization, I think, in benefits it's a first step. And as you stated, personalization around care is actually the long-term play, right? That's all throughout your life. And understanding in a year, you're going to be a different person than you are today, right? You're a different person today than you were a year ago. And so how does that continually change as we go along? It's pretty critical.
Yeah, I think what we're seeing is, frankly, we don't get highly personalized with our offering, but what we do is we pair what we provide with some of those offerings. And what you're starting to see is a lot of these pieces start to be stitched together to one seamless experience. So for us, what we've seen is, first, we have seen a widening of the different behaviors that people work on. So we talked a little bit about the fact that it's not just about traditional wellness anymore. It's about touching every line item on that balance sheet of your life, around mental well-being, financial well-being, social well-being, all those other pillars that are critical to one's overall sense of self-satisfaction. So we've expanded that, but it is still largely a menu. Each client gets their own unique menu, but the employees then sort of pick and choose their own path. But what we've seen an increasing usage of is what we call our referee framework, where you can designate for your goals an individual to verify your achievements to close that verification loop. And often that's a close friend or family member, significant other. Obviously, these are people who are privy to how well you're doing in a lot of your personal goals. These are not professional goals, these are personal goals. But now what we're seeing is a lot of clients will come to us and they already have telephonic health coaches in place. They have on-site care coordinators in place. We even have one client that has Weight Watchers at work on site. And what we do is we integrate these existing professionals to serve as referees on our platform to give them that more personalized and curated experience. And they will put together these personalized plans for the employees and then say, go make commitments around all these different these points that we want you to work on. So what we do is we now try to take these disparate assets that an employer is already paying for, bring it under one umbrella, create one seamless experience so that it's easier for the user, but it's continuous. The engagement is not fragmented as a result, and there's not these different pockets and these islands. And as a result, I think you get a more personalized experience, but you also get a better retention and a more engaged user as well.
And how do you keep that employee sort of engaged in their own care? Because that's the other thing. You can make these programs as sophisticated as possible, but if you aren't getting employees committed to participating in their own care, then you've got these beautiful programs and employees that aren't using them.
It's not the job of the employee to be engaged. I think it's the job of our platforms to engage them. And that's the critical element that I think has been missing for a very long time. And so you talked about the plan earlier, right? It's our job to produce that plan. And so we'll sell you a healthcare plan that comes with 88 free preventive care services. Go, right? That's typically like what happens. But really what we need to do is say, and this is what we do on our platforms. We say, we're gonna sell you this healthcare plan. It comes with 88, but there are 3 that make sense to you. Here's a primary care physician that lives 5 miles away, and you can book a doctor's appointment next Thursday at 9 o'clock, right? Like that's something that now we're engaging you, and you have to click a link, right? And I think that's what's core, instead of just providing them with, a menu.
Yeah, I think it's the last big challenge because we know how to at least improve people's health that have diabetes or stabilize people. We still struggle with how to engage them, right? And all these different variations that we're talking about, people on Talkspace platform, I think, do a really great job of engaging people in therapy. But the experimentation around engagement is going to make a huge difference about how the healthcare system moves and what we discover in that process and how it moves ahead. Because there are a lot of diseases we know how to treat. We just can't get people to pay attention to doing what they're supposed to be doing. And that engagement is going to become more and more critical. And I think we'll start seeing, my prediction is we'll start seeing not only the kind of thing that Jordan does in terms of incentives, But I think we're going to get to see some large employers actually levying fines against people that don't engage.
You mean the
in
stick?
Pardon me?
You mean stick?
Stick instead of your carrot. You're right. Because there really are some people that are just destroying their health when they know and have been done the kind of outreach that you're talking about. So it'll be interesting to see how that progresses. I don't think anyone's real interested in doing that, but at some point, my guess is people are going to wind up paying differentially, and they already are because of the high deductibles.
We're starting to see it. Yeah, I think you bring up a great point. So, for us, the engagement comes down to also really good incentive design, a mixture of carrots and sticks. On our consumer site, it's all based on the stick approach where users can risk their own cash against their goals. But on the corporate, we have a more carrot-based model, but we use a lot of principles in behavioral economics to nudge people and use different framing techniques to make them feel like the stick is still in play, even though it's all based on a points currency. So we can take away points when you're not doing as well. You can earn points as you are doing well. But in some cases, we're starting to see more of a pure stick with some of our clients where instead of offering a reward, a cash contribution to your premium for completing your HRA or your biometric screening, we'll see it as a punishment if you don't. Might be a financial penalty if you don't. You'll see some clients where you have a smoking attestation form where if you say you're not a smoker, you'll get a reward. But now we're starting to increasingly see some clients actually penalize people. And what's interesting, though, about the whole carrot and the stick is sometimes it's as simple as a framing technique. So it might not even be different economic trade-offs for the employee. So you could go to, if you're an employer, for instance, you talk about premium differentials in particular, to give an example, you could go to your employees, let's say they have to contribute $3,000 a year towards their healthcare premium, and you could say, hey, if you complete your HRA and your biometric screening and participate in one activity, we're going to contribute $500 additional to your premium. Well, now you only have to contribute $2,500. That's framed as a $500 carrot. You could take that same set of trade-offs and frame it as a stick. You can go to the same employees and say, hey, everybody, you only have to contribute $2,500 a year to your healthcare premium, but if you don't complete your HRA and you don't complete your biometric screening, then it's $3,000. Same choices, one's framed as a punishment, the other reward. You see a higher compliance rate when it's framed as a stick. And just in general, the stick is more powerful than the carrot. And there's a lot of really compelling case studies on it. Please feel free to argue.
I will.
At the end of the day, we offer more carrots than we do sticks, not because we think that the carrot's more effective, but we have to operate within the cultural norms of our clients. The clients don't want to be construed as being responsible for reaching into the pockets of their employees, so they're not comfortable with the stick approach. And so that is why we have a carrot-based model, and we have to do our best to leverage the behavioral economic principles to use a carrot-based model. They're still really effective, but at a pure sort of theoretical level, if you go to one person and you say, I'm going to give you $20 if you do this, or you say to them, I'm going to take away $20 that you already have in your pocket if you don't do this, the threat is, generally speaking,
Interesting.
more powerful.
And I see
I'll
your
be
grimace.
super fast.
No,
but
it's okay.
My feeling is if somebody isn't participating, you have to find out why they're not participating and not sort of penalize them for not. So one thing, and I'll be very fast, but on a super simple level, whenever our doctors are going to make a prescription for something, we actually put it into the hands of the user, and we say, hey, you have this, this issue, and we want to prescribe this drug. Do you accept? If you accept, that actually causes the e-prescription to be sent. But if you decline, there's a series of reasons as to why. This drug is too expensive. I've used it before and it doesn't work. We give them a series of reasons. You need to have buy-in. That is when you're going to take the drug. Otherwise, we're just writing a script and who knows what's going to happen. So I think generally speaking, like I said before, if you want people to engage, you need to get them as part of the plan. And if they're not engaging, you have to understand why and then make changes. And so we see 65% utilization across our book of business, which for a telehealth product is industry leading. So, and I think that's really because our ethos is let's work together and let's build a plan as opposed to penalizing you for not participating. Let's find out why you don't want to participate.
Okay. Well, we got some controversy. At least that's good.
See, I told you we'd do it.
Okay, so we're down to about 6 minutes. Does anyone have a question? There are microphones that we can bring. Who has the microphone? Okay, good. So we'll bring a microphone around. Okay, well, let's start right here.
Hi, thank you very much. The question I have is, all the companies you work for, do any of them talk about providing benefits for talk therapy online? You know, right now, if you are in Medicare, Blue Cross, Blue Shield, Aetna, Optum, whatever, you have to go one-to-one for therapy, and that's how you use your benefits. Are any of the companies talking about making, paying for Talkspace or therapy like that you know of? Do you see that happening?
So I don't think this kind of therapy, text therapy, is well known enough for that decision to be made. But if you look at telehealth, there was huge resistance with all of the large insurers for years, as well as some medical associations and insurance departments. That's pretty much changed. So most of the large insurers now use telehealth. And companies like American Well or Teladoc are in many of those companies, including Optum. And I think the future of this kind of therapy will be the same. I think it'll take some time, and I think people have to kind of adjust and look at the research and look at the outcomes. And I think you'll see it change to where there's going to be more adoption. And you have to remember the adoption happens because employers want it. So, if Apple said, I know people aren't leaving campus to go see one-to-one therapy, and I'd like this available to them, then the insurance company will do it for them. And then that tends to, and that's what happened with telehealth. A couple large companies decided they wanted it as part of their benefit package. It actually turned out to save everyone a lot of money. And get good results, and then it just started rolling.
What's an example of telehealth here?
Telehealth is like video telehealth or telephone telehealth. You wake up and you have a sore throat and you can't get in to see a doctor, and you call Teladoc, and you might do it on video. You might do it mostly by phone, actually. So I think there's a good future for it. I think it'll take some time.
Yeah, to take a different approach from the employer is because of the market that we're in, we actually deal with a lot of large independent contractor audiences. And so we've partnered with Uber, Etsy, Care.com, like Intuit Self-Employed, and Postmates, even kind of name those types of organizations. And I'll say, though it's not an employer, because for them, like they're not providing benefits, right? But we are a platform that can provide benefits on behalf of their contractors. And those folks are actually very interested in this kind of thing because they're building it with us from the ground up, right? There aren't packages that they're putting together. It's more like when we think about the right framework for health plans, like what does that look like? When we think about the right framework for dental insurance, how should we frame it? When we think about, as I told you, a lot of people will come back and say that depression is an issue. And so that's one that we're actively talking about right now. And it's like, they can choose anything because they're not restricted or mandated, right, to do anything. And so with those audiences, it's incredibly interesting to look at everything, to be honest.
We need to get you together with the BD guy for Talkspace.
I'm not scared.
Maybe we have time for one more question? Okay, right over here. Can you use the microphone? Okay.
Hi.
Woo!
Sorry. I work for Talkspace. I'm the staff writer, and one issue I've discussed is like mental health, the conversation of mental health and illness in the workplace. So I wanted to ask where all of you see that going. So like, will people become more open to discussing it in the workplace to the point where, having a conversation about like, oh, I forgot to take my insulin today at work is similar to, oh, I left my antidepressants at home, and, employees having that conversation with their employers and not being scared to bring that up.
I'll say my version of it, which is, I'm not sure that, and I've worked in large companies, that many people said, oh, gee, I forgot to take my insulin today. I mean, I think we all have a certain amount of privacy around our healthcare issues. And I think you're right, mental health has had a specific kind of stigma. But I don't think we can expect to go the other way, that people are just going to talk about it when they don't talk about, oh, I had a stent put in last week and that's why I was out of work. So I think we need to calibrate our expectations where there's less stigma to how people think about and share their general healthcare condition versus thinking there's stigma now and someday we'll all be talking about, gee, I had an anxiety attack last night, so I didn't sleep so well. So I think, we have to calibrate back if we expect, to be similar to regular health, what people do with their regular health conditions.
Yeah.
I would agree. I don't think we're quite there yet. I think we have a ways to go. I think especially when it comes to mental health, there is the stigma, and it's slowly being destigmatized. But I think it's a long journey, and I don't know if it will ever get quite to that level where people will be, completely relinquish their privacy. I think there's always going to be a set of, and it's going to be down to personality traits as well. There are going to be people who are comfortable, and there's going to be people who aren't. And it's also about making them feel okay that they don't need to share everything as well. I think it's about choice.
And in the workplace is especially a sensitive just place to talk about that. I mean, that's you can interpret what someone says in so many different ways, and you think about it in your next meeting with them when they don't do. I mean, that's a really sensitive place. So I think even as people open up, the workplace is probably the last place that they'll start to open up with that kind of thing about.
All right, well, we're now going over time, so I want to thank everybody on this panel. Let's give them a round of applause.